Hello everyone, my name is Dr. Rajeev Sivasankar. I'm the Director of Neurovascular and Peripheral Interventional Radiology at Fortis Hospital Mumbai. Today I will be discussing something called brain aneurysm or cerebral aneurysms. So many a times I'm asked by my patient clientele as to what exactly is an aneurysm, how did I get such an aneurysm, can I do something to treat it or should I not treat it? Or many times a family member has been detected to have an aneurysm and people are quite confused about what this whole disease entity is all about. So starting with what an aneurysm is, anywhere in the body where there's a blood vessel, if that abnormally dilates or enlarges in size, then that condition is termed as an aneurysm. And since it occurs in the vessels of the brain, hence it's called a brain aneurysm or a cerebral aneurysm. So consider it like a focal bubble. Commonly the shape is that of a round sphere. The other shapes that can occur are, it could be tubular in shape, it can be complex in shape, it can be multi-layered in because of multiple layers of thrombus surrounding it. So the morphology of the aneurysms depends on what is the underlying condition which has caused it. They can also vary a lot in their sizes. It can be as tiny as a millimeter to as large as 3 centimeters. So an aneurysm comes in various sizes as well as shapes. Now the next part of what commonly troubles people is that what should I do about this aneurysm? Many a times they've been told in case they have not come in with a ruptured setting whereby the aneurysm has already caused its devastating effect of having bled into the brain, then they are told that they are sitting on a time bomb. So should they get treated or should they not get treated? So let's look at both these subsets. Let's say there is an individual who has had a bleed in the brain caused by the rupture of an aneurysm. This condition classically causes something called subarachnoid hemorrhage, and this condition is deadly and needs to be treated immediately in an emergent manner. The way to treat it in almost all cases can be endovascular. Of course, surgical clipping also exists for some morphologies, but endovascular treatment has made rapid strides over the decades so as to provide a very robust and very easy way to treat these deadly diseases effectively. And how do we do it endovascularly? Which means we thread a tiny catheter within the blood vessel. We go into this focal outpouching of this bubble and we either coil it, that is put in thin threads made out of platinum, and we can use devices such as stents or balloons to help keep those coils in place. So that's one way of treating it. For aneurysms which are not coilable, for example, if you have something which is you can say it's bulging in the form of a tube, then you can't actually find a place to put a coil into that. So in such scenarios, we put in specialized stents called flow diverters. So that's another way of treating these aneurysms. The effects of the bleed are also to be dealt with apart from treating that aneurysm, which is why we have a multidisciplinary team which looks after things like the patient's hydration, the patient's electrolytes, and the effects of the bleed such as vasospasm. Now coming to the subset of aneurysms which are detected incidentally. For example, a patient might have had a headache or might have eye symptoms wherein there is double vision, and the patient is referred for an MRI by another doctor, and on the MRI they have detected the presence of this bulge which we call a brain aneurysm. So obviously people are very worried. What should we do about it? Which raises the question that do we treat all aneurysms? So the answer is not straightforward. The answer is there are many factors we take into consideration while making this decision. And those factors include what is the patient's age, what is the size of the aneurysm, what is the location of the aneurysm, what is the morphology of the aneurysm, that is the wall smooth, does it have lobulations, is it a partially thrombosed aneurysm, what is the underlying etiology of the aneurysm, etc. After taking these factors into account, we make a decision as to what is the best modality of treatment. For example, if you have a 75-year-old lady who's got an incidentally detected 3 millimeters aneurysm, we are not going to treat that aneurysm. We're just going to say, okay, we'll watch and follow it up. However, if you have a patient who's say 35 years of age and has got a 5 millimeter aneurysm, we would probably offer treatment, because treatment modalities have become really safe and have become very sure also, and there is a definite indication to treat these patients to prevent long-term mortality and morbidity. So because of the technological advances in neurointerventional hardware, we have come to a stage where we can offer patients a very safe and secure method of treating these deadly conditions. Thank you very much.